So why should we be so concerned about adequate calcium in the diet? Calcium is a critical nutrient for bone development. During our young years, during childhood and adolescence, we're maximizing our bone growth and our bone density. And during these critical periods, we really need to have optimal calcium and vitamin D intakes in order to maximize the strength of our bones. And in the U.S. diet, there's very few good sources of calcium. Dairy foods really are by far the best and most dominant source of calcium in the U.S. diet. This is a critical issue because humans are living much longer. In fact, our life expectancy has doubled in the last 100 years. And so as we go through our aging process, there's a natural loss of bone. Bone density peaks in early adulthood, probably in our 20s. And as we go through life past menopause and past reproductive years, that bone density starts down. And the higher the density is before it starts down, the better chance we have to maintain our bone mass. Also, the better our diet is as we age, our exercise patterns, vitamin D and calcium intakes, the more likely we are to maintain our bone mass. So maximizing this bone density as we grow old is a critical health component to prevent the breakage of bones that happens in many elderly. And this bone breakage, often a hip, sometimes a leg, is a critical downward spire for many elderly. If we can prevent that bone breakage, we can reduce morbidity and mortality. We can increase lifespan substantially and the quality of life. Many people who break a hip in their older years never recover fully. So it's an absolutely critical issue for all of us.